everyone. We are very excited to have you here to share our study exploring nurses and nursing students' perceptions of artificial intelligence's influence in nursing education, a survey research study on Reddit. My name is Dr. Nicole Zhang, and I'm at San Jose State University.
My name is Uma Arunachalm. I'm a doctoral student at the Johns Hopkins University.
Artificial intelligence is making significant strides across various sectors, and especially in healthcare. In the realm of nursing, artificial intelligence is being integrated into educational practices to improve learning outcomes. This study that we conducted aims to explore the perceptions of nurses and nursing students regarding the influence of artificial intelligence on nursing education. Understanding these perceptions is crucial for identifying both the potential benefits, concerns, and much more regarding AI. The specific objectives are exploring the perceptions of nurses, identifying potential benefits and concerns associated with the integration of artificial intelligence, assessing the level of acceptance and readiness of nurses and nursing students towards artificial intelligence, and understanding the potential impact of artificial intelligence on the future of nursing education.
Here are the methods. A structured anonymous survey was utilized, featuring both close-ended and open-ended questions to capture a wide range of perspectives on artificial intelligence in nursing education. Participants were recruited from multiple subreddit groups targeting nursing students, nurses, and nurse practitioners. The survey was available for 6 months to ensure a comprehensive sample. Quantitative data was analyzed using descriptive statistics with SPSS statistics, while qualitative data underwent thematic analysis to identify recurring themes and patterns.
The results of this study, first, we can discuss the makeup of the study's participants. The study surveyed a diverse group of participants, primarily from the United States. While the age distribution was varied, the age 35 to 40 years old was the most common. In terms of race, 71% were Caucasian, with smaller percentages of Asian, Black, or African American, and other racial groups. You can see all of the specific data in the demographic variables table. We also looked at the role and level of education. The major finding that we can relay in the results is that there was a uniform agreement in the AI benefits. This means that across all of the questions that were analyzed, there was little variability in the responses. The median scores that we identified in all categories in the interquartile ranges were consistently 0. And this means that in general, there was agreement on the benefits and the concerns of artificial intelligence. So the next part of the analysis was the qualitative analysis. There were 4 themes in both the challenges and benefits sections. For the challenges, there was a theme of concern for the potential of bias, and that there is a risk of artificial intelligence amplifying bias, especially in decision-making processes. We also found a theme of loss of human elements. And so the participants expressed that concern over the potential loss of human touch, which is vital, and the development of therapeutic relationships, as well as facilitation of empathy-based practice. We also found that effective utilization of AI could be a concern, and that there needed to be appropriate use of AI when integrated, and specifically how it needs to be integrated so that it doesn't produce a negative therapeutic impact for nurses. And finally, the other challenge was educator preparedness. And so while AI was generally considered to be important and there was a widespread support in the survey, um, basically, the educators need to know how to implement AI in order to best facilitate learning. So for the benefits, we found that AI would be best used in a simulation and virtual learning scenario. And so AI technologies are seen as beneficial for providing a controlled and free environment for practicing clinical skills. As you know, it's very important part of nursing education to have um, a variety of clinical skills preparation scenarios. So this is seen as a potential area. Machine learning was identified as a tool with significant potential for identifying knowledge gaps and customizing specific learning experiences. The use of large language models, technologies like ChatGPT are recognized for assisting with research and personalized learning support among the participants. And finally, personalized learning is perceived that the AI tools could be used to tailor the experiences of individual students to help them in problem areas and to overall improve their learning experience through making it a little bit more personalized. Um, so the implications of this study are that um, while there is an openness to the integration of artificial intelligence of nursing education, there's also significant concerns, and those need to be addressed for the successful implementation of AI technologies in our field. We also found that the unified perspective on AI in nursing education among the participants was presented. And so the lack of variability in the responses that we were seeing provide a strong foundation for advocating for the integration of artificial intelligence into educational practices. However, the presence of some moderate or low ratings, the presence of some moderate or low ratings points to areas where further exploration and dialogue may be necessary to address the concerns and uncertainties with AI. We want to bring forward the emphasis on educator preparedness and maintaining the human aspects of nursing that were brought forward in the qualitative analysis. Those are the final findings of our study. We look forward to all of the nurses and nursing educators who can consider future research on this topic and how nursing education can integrate artificial intelligence. Thank you for your time.